Hello, I'm Dr. P.J. Mazumdar from Arogyam Hair Transplant and Cosmetic Surgery Clinic. So today I'll discuss with you hair fall and hair loss causes. What are the causes which bring about hair fall and also the treatment. So I'll just discuss in short the various causes and various treatments. So now we come to the treatment of hair loss. So there are various forms of treatment. There are many different steps of treatment. So I'll describe them to you now. The first step of treatment begins with investigations. We first have to identify the cause of hair loss. So for that we do all the blood tests like vitamin levels, hormone levels, sugar, cholesterol, triglycerides, vitamin D, and all important parameters. Especially the hormones are important for this: thyroid hormones, testosterone, FSH, LH, and sugar. So all these tests will help us to identify the cause. In case of androgenetic alopecia or male or female pattern baldness, the blood tests are expected to be normal. Everything comes as normal, and that is also an indication that it is androgenetic alopecia. And in case it is caused due to any disease, we can find that abnormality and then we treat that abnormality. For example, if there is thyroid hormone abnormality, we treat that by giving thyroid supplements, or we treat blood sugar or high levels of testosterone. In that way, we can treat the cause if we find a definite cause. So the next step of treatment is medicines specific for hair loss. So there are mainly three medicines which we use for this. First is minoxidil. So minoxidil is a vasodilator. It increases the blood flow to the scalp, and in that way it helps the growth of hair. The next medicine is finasteride. So finasteride is a DHT blocker. In male pattern baldness specifically, we find that dihydrotestosterone is believed to be the cause of this. So finasteride blocks the production of DHT, and in that way it helps in male pattern baldness. And the third treatment that we do is vitamins. So we give vitamins like biotin, zinc, etc., which are found nowadays in combination. So these vitamins are also very essential. So these three medicines: mint chop, finasteride only for males, and vitamins. These are the three medicines mainly that we use for hair loss. So the third important treatment for hair loss is PRP. PRP is platelet rich plasma. So in that, what we do is we take about 10 ml of your blood and we process it. We process it from 10, so that from 10 ml we get 1 ml of PRP, or platelet rich plasma. So PRP has a very high level of growth factors. It is rich in platelets, and that releases a large number of growth factors, different types of growth factors. And that 1 ml of PRP is injected into the scalp, into the hair loss areas. So there it promotes hair growth. It is quite effective. We have seen it being effective in both male and female patterns of hair loss, in any kind of telogen effluvium, in case of hair thinning, hair breaking, etc. So it is quite an effective treatment for all causes of hair loss. So the next treatment is laser therapy. So we use low level laser therapy, or LLLT, that uses infrared lights, infrared lasers, which is available in a sort of helmet like structure, which is placed over the head, and that shines that red infrared laser light onto the scalp. That also promotes hair growth, and that is also quite effective. The next step after this is SMP, or scalp micropigmentation. In SMP, what we do is we make small black dots which we tattoo into the scalp. So what that does is it does not replace hair, or it does not promote hair growth, but it covers up the bare areas of the scalp. So in that case, when we do this in those people who have been losing hair, whose scalp is showing through their hair, so when we put these small tattoo-like spots on the scalp, it covers up those areas, and then it is a camouflage actually. We cannot see the baldness. It covers up the bald areas. So it is also very effective for those who have already lost hair.